that way. So obviously you're going to have extension and medial collateral, ulnar collateral ligament, or was it that way? You know, so now you're going to have the lateral and extension problem as well. Very rarely you're going to have, you know, flexion issues, because bar somebody gets their thumb stuck in or punching wrong or something like that, you can have injury. So how will you assess? What's your assessment of a thumb?
Active person.
Yeah, so the usual. So active, obviously he's just going to get them to move it, what the range of motions are. Passive, what are we assessing passively then?
The joint.
Exactly, so you're assessing the joint, so, and your accessory glides, they're big time here. So how much movement is in the joint, how much laxity is there within that joint position. So stabilising the joint, moving it side to side, open up, kind of give a valgus stress test, if you know what I mean, on this side, valgus stress test on the other side. What will resisted give you? Strength, you know, just to give us power in terms of strength, so ruling in. But most times you are looking at joint problems here. You know, very rarely it's your distal DIP, it tends to be your proximal joint. What do we need to rule out in terms of thumbs? Fractured, and obviously the scaphoid being the most important thing. So obviously that's in your anatomical stuff box, being able to assess that, look at palpation. Anything else you can use to rule out kind of fracture or scaphoid? Ultrasound.
Shake test.
And we kind of say compression test here. Driving down into the scaphoid. So if there is any problems there, it tends to show up pretty much so. And nails, not too bad. In terms of, you know, management of scaphoids, it tends to be 10 days plus after an X-ray will show up. So that tends to be problematic as well. So if you're unsure and, you know, person is acute, don't be afraid to go back after 10 days and get it re-x-rayed again if it still hasn't settled down. Why do we have to be so concerned about the scaphoid?
Blood supply.
Yeah. So the bone can necrose. Okay, so there's necrosis. You can hold up your arm. It's like, yeah, you have necrosis of the scaphoid. We've had one guy in the clinic that had thumb pain for about 18 months, and unfortunately the bone has gone to nothing. So they had to take a hip bone graft and place that into his new scaphoid. You know, so that's the level. If you do have a necrosed bone and the bone wears away, they have to take a bone from somewhere to put it into that. So that's the level. You know, it's not nice getting part of your